I'm Carl Alexander with P-DTR, and this is Phil Runge. And Phil has been experiencing some numbness and tingling, which presents like an ulnar nerve compression or an ulnar nerve entrapment. His symptoms are on both sides of the body, a bilateral numbness and tingling. Tell us a little bit about when you feel that and what's going on.
I feel it most when I'm sleeping on my side or on my stomach, or if I have my hands pretty much above my head. For more than 15 seconds, I start feeling the numbness and tingling.
Yeah, okay.
On both sides.
And when you're in that position, you feel tension of the nerve?
Yeah, I feel
tension. Like it's pulling?
Like right here.
Okay.
Here? Yeah.
Okay. So if you bring your arm, if you bring your elbow back farther, it'll give you more tension.
Yeah.
Right?
Yeah.
Okay. Yeah. Both sides. These two fingers?
Yep.
Okay. So classical ulnar nerve tension, as well as some sort of compression of the nerve. Where could this be coming from? When we use P-DTR and its approaches, we can evaluate where this compression could be. Traditional approaches would look at maybe doing a cervical glide to help symptoms, or tractioning the nerve in different ways, which can be sometimes a little bit too aggressive for a nerve, because the nerve doesn't really want to be put on too much tension and stretch. So we can evaluate some of the muscles related to this, what he's feeling. So one of the muscles that you can test is the flexor carpi ulnaris. So wrist is flexed here, and as I test this, as I test this muscle, it's weak right away. Okay, on the other side, hold there. He has a little bit of strength, but it diminishes very quickly. We'd often look to see if the issue that he's having is stemming from the nerve root, so the cervical nerve root. So take your head into extension. We'll evaluate to see if this will help. And when we take him into cervical extension, his flexor carpi ulnaris becomes strong on both sides. If he goes into cervical flexion, no help. Still weak. If anything, it feels qualitatively weaker. Okay? So classical approaches would be to take the cervical spine into some gliding, some movement, to see if that improves the symptoms. So Phil's going to demonstrate that. So a little bit of cervical extension, some gliding. Okay? You can see it's actually hard for him to bring his head forward after he does the glide. So we'll evaluate that as well. And often, movement and exercise and stretching can be helpful. However, with P-DTR, we can evaluate if there's only a slight change that isn't permanent. So let's reevaluate after the next one. Go ahead. Last one. Great. Okay. So we'll retest the flexors. I'm just testing a few times to see if there's any fatigability there, and there's not so far. On the left, it still fatigues after about 3 or 4 reps. The right is actually staying strong. And as I continue to test, we can get a gauge if how much compression of the nerve there is, because after testing multiple times, then the muscle will lose energy from the blood supply and will become hypoxic, and so the muscle will naturally become weak. So we did see a slight change here, but not on both sides, and it did start to weaken on the right. So with P-DTR, we can evaluate where the source of this issue is coming from. So often we'll be looking in the cervical spine. So I'll use an indicator muscle here, push up. Okay, and so when I go to in and around the facets of C6, we get a weakening of the indicator. So we'll test to see if this is the main issue that he's having in this location, and it is. So what I'm going to do is I'm going to turn the signal down here. I'm going to stretch. I'm going to give a reflex. And we're going to see how this affects the muscle test. So go back. This one was strong before for several. And now staying strong longer. Feel better for you? Mm-hmm. On this side. And the left side is much stronger as well. But what happens when we give a stretch to that same facet? And then reevaluate the muscle, it weakens right away. So the stretching, the gliding initially helped, but didn't fully resolve his issues. With P-DTR, we can evaluate this dysfunction, what it's paired with. There's another piece of this as a compensator that we need to find. Hold here. When we find that pair, we have strength in his system, and then treating it, then we'll see both a full resolution, and even after we give a stimulus, holding, the muscles remain strong. And if we bring your head forward, this is another challenge that we had. Yep. Also remains strong. Retest the, and you can see, yeah, just initially, yeah, bring your elbow back. Yeah, there you go. So it's a little bit easier for him to get into that position, go farther. How's that feel for you?
Feels way easier to do. Way easier.
Not that much tension?
No.
Great. So with P-DTR, we have ways and tools that we can evaluate the body and the nervous system. We can take a nerve entrapment, a compression of the nerve, two of the same things, and we can treat this in a very simple and gentle way. This is P-DTR. Find us online at pdtr-global.com.